Then another strategy is sometimes we start to get people interested, professors interested, by not calling it leadership, or starting with something that is easy to get professors, to join in, which is, for example, time management, right? And you speak about time management, everyone will agree they don't have enough time. Then you speak about delegation, what can I delegate and how do I delegate? And at the end of the day, how do I delegate nicely leads over to leadership. We've also seen great examples in which professors had first their postdocs join a leadership training and, sort of test, does this actually do anything? That also has been a strategy. Another one is to not call it, leadership training, but an exchange of experience among professors. And they can talk about, what's been challenging. And maybe you find a professor who openly talks about his or her experiences in leading. So I think these are very different avenues to try to convince the colleagues. But overall, as I said before, I think the interest is really rising, and we get more and more demands from all sides.
That's great to hear. There's more interest. And Thomas, would you like to add anything?
Well, just from own experience, when I started my professorship at University of Mainz, it was part of the goals and part of the obligation to have a leadership training for 6 days, 3 two-day workshops. And this is something which every new professor at the University of Mainz gets. So this is normative, and it's kind of organizational culture, and I think that's a good thing to do.
Oh, that's great to hear. I think we need more of that too in other institutions. So I jump to our third question, which is one of the more highly voted ones, and that is, what are signs of bad leadership? Are there certain criteria that students or junior researchers should not tolerate? And when would you know would be the right moment to speak up?
Yeah, maybe I start. Well, that's I think the line is always crossed when you start to feel bad about it for a longer time frame. It's in relationships, it's normal to have like a conflict, to have a dispute, to not always get along perfectly. But if for a longer time frame, it really gets a burden, and you may even fear to go to work to meet this person, for example, or get out of the way, then it's latest to think about what to change about this relationship, and what are the causes. It's hard to say what are the, of course there are lines which shouldn't be crossed, and I think we don't have to talk about this, like sexual harassment, or really get into private and personal things, being ridiculed in the public or in the group, especially if there are witnesses about such behavior. But it's maybe even one level below, and if to start to think about doing something if you really feel that the relationship with your supervisor is unhealthy for you.
Great. And Claudia, do you have anything to add?
I think there's a very valuable comments in terms of the question, when do I start? I think having a proactive approach to, managing the interaction, I think is important. So I think, early on, it might not be, severe. It might not be, ideally, you just might be a little confused about what's expected of me, right? And I think, again, the earlier you ask, the better, because obviously you're not wasting as much time. Maybe you don't find yourself in a downward spiral. And also the professor notices. Now I'm speaking in my role of professor. A lot of the times it's hard to notice what's really going on, and sometimes my experience is that even after conversations with PhD students, I think everything's clear. I think they're, happy and know what to do. And then later on, one of the postdocs approaches me and says, such and such, was, confused or unhappy or whatever. And I say, oh, really? I just spoke with them. I didn't, this is strange, but I didn't dare to speak up. And so I don't know. So I guess I'm encouraging you to ask those kind of questions and also signal, when things are not right, because it's not always obvious to the leader.
Mm-hmm. Great, thanks. We're kind of running out of time a bit, and there's still a lot of really good questions. But so maybe we could make one more, and then close things up. And then I was also thinking that even after the session, if the speakers would be happy to maybe address one or two more questions that we could possibly post later on, along with the posting of the recording of the webinar. But yeah, we can talk about that later. But so I just wanted to address one question which has been highly voted about power abuse, specifically in the context of gender. Yeah, if you have anything to say.
Okay, first of all, as you might know, and I think some of the slides Thomas showed alluded to that, right? I mean, depression being even more frequent among female PhD candidates. Another aspect that we just alluded to very quickly, that I have to say, there's a new study came out last year on sexual harassment in academia. I was totally shocked by. The numbers are much higher than I thought. So yeah, there is an issue, in all honesty, and at least, I think there's a lot to be done still. And this is obviously a universal phenomenon, right? I mean, it's not specific to, Germany. So yes, I think there's a lot to be done. I think finally, at least it's on the table, with scandals and things like that. As terrible and horrifying as they are, at least, in the Me Too movement, etc., the topics being talked about. And I think more and more organizations, I'm also speaking with some of them, are introducing mandatory trainings, even on that. So, what is harassment, what's okay, what's not okay. I think that the more we also work with across cultures, it's important to highlight what's not okay. And then, yeah, there's some research showing that the stereotype of an academic is still more in line with the stereotype of, males than females. But the good news is that the numbers are increasing. We've made a lot of progress in the last 10 years, especially. And of course, as you know, many organizations, including, this is really important, the funding organizations, such as DFG, take this serious. And maybe that's my last sentence on this. Having been, I actually took part in 3 rounds of excellence initiative. In the first one, I was a postdoc. In the second one, I was a newly appointed professor. And the third one, I was a member of the management board. So from very different perspectives. In each round, the aspect of gender and gender equality got more important. And the reviewers and DFG and Wissenschaftsrat, they really, really care. And they really asked tough questions. And in all the reports, it's relevant. So I think at least there is movement.
Nothing to add at the moment.
Great. Okay. Thanks so much. And unfortunately, we're kind of reached towards the time of the end of the webinar. So I just want to wrap things up and say thank you so much to Thomas and Claudia for excellent talks, and especially it's really opened my eyes to ideas of how we can really deal with situations of power abuse, because actually before this talk I would have had no idea how to navigate the situation. So yeah, I think that's really, really invaluable. And yeah, it's also thanks a lot to the participants for coming, giving such great questions. I think there was some really, the top questions were really, I think, hit a lot of points that I think many people have on their minds. So yeah, it was really nice to see that these questions were so well formulated, and so yeah, I think this has been a great webinar. It's been a really nice collaboration with the two working groups, and the relationship between mental health and power abuse is so closely tied. And yeah, I really hope that this will be able to continue this series of webinars and continue this discussion within our community, and try to raise awareness and try to encourage people to be proactive, as Claudia and Thomas have been mentioning, to speak up, because yeah, I think it's easy to forget that protection against abuse and support for our mental health, that they should really be, I think, very basic fundamental human rights for everyone. And so yeah, so now I would like to just mention again that we recorded the webinar, so we'll be posting it online. And to give the final statement, I wanted to pass over to Anna, I think. She's just going to, I think we have another poll coming up, Anna.
Yes, we do. So thank you very much, Elliot. And I also just want to thank our speakers. There are definitely a lot of food for thought for us and for our working group and our work on this topic, especially when it comes to social support. I think there's a lot we can do in our PhD network as well.
I just wanted to say thank you so much for organizing this. I have to go because my PhDs are waiting for me.
Yeah.
But good luck to all of you guys.
Thank you. Bye.
Bye.
Before everyone else is leaving as well, I just want to ask Irene to start our second poll, just to get some feedback on how you like today's webinar, maybe what you are interested in as well. So this should be shown up on your screen. And yeah, I also just want to thank Elliot very much for taking over and moderating today, and the working group mental health, also the people you didn't see today, like Irene, who organized all the backend, and Dolly for all the input, and also the working group communication, who did all the advertising online. And I just want to bring up this again, the Leibniz PhD Net website. This is also the place where you can find all the information about all the working group, mental health, and prevention of power abuse, but also where you will find the follow-up, a blog post on this webinar with a link to the recording. We will also see that we can save all the questions we couldn't answer today to address them either in the blog post or take them with us for future work in the working group, and maybe for a next upcoming webinar, and get some inspiration. Also when it comes, for example, to reporting abusive behavior, you can find contacts for the ombudspersons, for example, of the Leibniz Association online as well. So we make sure that you get all this information and find this information online. And that's from my side as well. So thanks everyone, and take care, and goodbye.